Cervical cancer is one of the most preventable cancers, but early detection is key to successful treatment. The primary cause of cervical cancer is the human papillomavirus, HPV, a common virus transmitted through sexual contact. However, other factors like smoking, weakened immune systems, and long-term use of birth control can also contribute. Certain strains of HPV, especially HPV-16 and HPV-18, are responsible for most cases of cervical cancer. Getting vaccinated against HPV can significantly lower your risk. The HPV vaccine is recommended for both boys and girls starting at age 11 or 12, but adults up to age 45 may also benefit. CDC screening guidelines: women aged 21 to 29 get a pap test every 3 years. HPV testing is not recommended in this age group unless needed after an abnormal pap test result. Women aged 30 to 65, 2 options: pap test every 3 years. HPV test every 5 years, preferred method, or co-testing, pap plus HPV test, every 5 years. Women over 65 can stop screening if they have had regular screenings with normal results over the past 10 years and no history of serious precancers. Women with a history of cervical precancer should continue to be screened for at least 20 years after diagnosis. Women who have had a hysterectomy may stop screening if the hysterectomy was not due to cervical cancer or precancer, and they have no history of cervical precancer. Women vaccinated against HPV should still follow the regular screening guidelines for their age group. Regular screening is crucial. Pap smears should start at age 21, followed by HPV testing at age 30. Combining both tests, known as co-testing, can provide the most accurate results. Pap smears detect abnormal cells in the cervix, while HPV tests check for the virus itself. Catching abnormal changes early allows for prompt treatment before cancer develops. If cervical cancer is diagnosed, staging will determine how advanced it is. Stages range from 1 to 4, based on tumor size and whether the cancer has spread. Early-stage cervical cancer can often be treated with surgery, such as a hysterectomy, or localized treatments like cryotherapy or laser therapy. For more advanced stages, treatments may include radiation, chemotherapy, or a combination of both to target cancer cells. Treatments based on staging: stage 0, carcinoma in situ. Treatment: localized procedures like LEEP, loop electrosurgical excision procedure, cryotherapy, or laser therapy to remove abnormal cells. Conization or hysterectomy may also be used in some cases. Stage 1, localized. Stage 1A, microscopic cancer. Treatment: surgery, simple hysterectomy, or radical hysterectomy if deeper invasion. Radiation therapy may be used if surgery isn't an option. Stage 1B, visible tumor. Treatment: surgery, radical hysterectomy with removal of nearby lymph nodes, or radiation therapy with or without chemotherapy. Chemotherapy example: cisplatin, given with radiation, known as chemoradiation. Stage 2, locally advanced. Stage 2A, cancer beyond the cervix but not into the pelvic wall. Treatment: radical hysterectomy or radiation therapy with concurrent chemotherapy. Chemotherapy example: cisplatin, sometimes in combination with 5-fluorouracil, 5-FU. Stage 2B, cancer extends to pelvic tissue. Treatment: primarily radiation therapy with concurrent chemotherapy. Chemotherapy example: cisplatin or cisplatin with 5-FU. Stage 3, locally advanced, spread to pelvic area. Treatment: Radiation therapy combined with chemotherapy, chemoradiation, is the standard. Chemotherapy examples: cisplatin, standard, or cisplatin with 5-FU. Stage 4, metastatic. Stage 4A, cancer has spread to nearby organs. Treatment: chemoradiation or surgery to relieve symptoms. Chemotherapy examples: cisplatin with paclitaxel and possibly bevacizumab, Avastin, a targeted therapy drug. Stage 4B, cancer has spread to distant organs. Treatment: systemic chemotherapy is the primary treatment. Chemotherapy examples: cisplatin and paclitaxel, often combined with bevacizumab, a targeted therapy to inhibit blood vessel growth in tumors. Recurrent cervical cancer treatment, chemotherapy examples: cisplatin, carboplatin, paclitaxel, and sometimes combined with bevacizumab for recurrent or metastatic cases. Some cervical cancers are linked to specific genetic mutations, and targeted therapies may be used to improve outcomes. After treatment, follow-up care is vital. Regular exams and pap smears are essential to ensure the cancer doesn't return. With early detection, vaccination, and personalized treatment, cervical cancer is highly treatable and preventable. Talk to your healthcare provider about your screening options and stay proactive in your health.